Hello everyone, this is Dr. Mostin. Today I'm going to discuss regarding the news chart. How to fill this chart, how to interpret this chart. This chart is basically used in hospital to assess the severity and the deterioration of the patients, and on the basis of that we are going to describe the escalation of care, either we are going to keep the patient in the ward or ICU, and how often we should monitor the patient. So first I will be explaining everything here on the board, and then I will be explaining everything on the news chart as well. Alright, so first doctors, this chart, at the top of this chart there will be biodata of the patient. You need to fill the name of the patient, you need to fill the date of the birth and the date of admission, and then just below it there will be date and time you need to fill. After that doctor, there are basically 6 parameters we are going to fill, and we are going to exactly use it like A, B, C, D, E. Like what are the vitals we are going to look in A, B, C, D, same we need to fill this chart in the similar way. So if the title says A and B, it means here we are going to check the respiratory rate. So doctors, we just are going to make a dot whatever respiratory patient is having, and then we will be going to score that parameter. Next, first A and B, it includes respiratory rate. Then next would be saturation, oxygen saturation. Doctors, remember one thing, this is so important. Oxygen saturation, there are basically 2 boxes. One saturation is for all the disease, and one is specially for COPD. So you need to fill one, either if it is COPD case or general case. Don't fill the both of them. Alright. The next is doctor, air or oxygen. If patient is on like room air, or if he is having any oxygen attached to him, on the basis of that we are going to score. Next is C. We are done with A and B of ABCD approach. Next is C. C is blood pressure. Here one most important thing regarding blood pressure is, doctors, here we are going to just use the systolic blood pressure, not the diastolic. Even the lower most value shows 50, some people think it is diastolic, but no doctors, in news chart we are going to just use the systolic blood pressure. Next is the pulse. On the basis of pulse we are just going to fill, put a dot, and then calculate the total score. Last thing is consciousness and temperature. So doctors, regarding consciousness, remember, patient is conscious, score is 0. But if we will be using here AVUP scale, means if patient is not alert, like he is just responsive to verbal response or on to the pain response, he is going to get score of 3. Alright, this is like means severe one. So last is temperature. We will be using the temperature and going to put it there as well. Alright, so doctors, next thing is the how we are going to interpret this. So if score is 7 or more, this is an acute emergency. We need to have emergency response. Like after looking at the new score and checking that score is high, we will say, I can see that my patient score is more than 7. I would like to call for help. The urgent care team, like critical care team, they will come and assess my patient. Might need to shift to the ICU. Alright. Next is score 5 to 6. Here above 7 we need emergency response, 5 to 6 we need urgent response. So we will say, I can see that my patient score is 6 or 5. We will say, so I would like to call for help the medical emergency team. More than 7, critical care team. Alright. 5 to 6 we need 5 to 6 we need medical emergency team. Alright. And after that, if yes, a single parameter has score of 3, then we need ward-based doctor care. Ward-based doctor will assess the patient, and on the basis of that he is going to decide the escalation. Alright. And if it is 1 to 4, then the nurse, ward-based nurse will assess the patient, and on the basis of that she is going to decide escalation, either she need to ask somebody for help or not. So this is the simple interpretation. Just revising it again quickly. 7, it is emergency response, critical care team. 5 to 6, medical emergency team. Alright, and if a single parameter has score of 3, we need ward-based doctor to look. And if it is 1 to 4, then the nurse will be just monitoring the patient. Alright, so doctors, now I am going to show you here on this news chart, right, the interpretation. See, I have explained everything on the board, and now here's this chart. It has this full name. Alright, then this date of birth, date of admission. You need to fill these details first of all, then date and the time. Alright, here you need to put the date, here you need to put the time, and Now after that we will start filling these parameters, all these parameters. Alright. So see, the white color, the score would be 0. This yellow color, alright, this yellow color here, it has a score of 1, and this orange color score of 2, and this red color score 3. Where we are going to put the dot, then we will be calculating the score on the basis of that. So here A and B we are going to put dot on the basis of respiratory rate. Then saturation, I explained before as well, saturation has 2 boxes for all other diseases, and this is specifically for COPD. See here, you can read as well, only use scale to under the direction of qualified clinician, and if our indicated target is 88 to 92. Alright, so doctors, this is specifically for COPD, this SPO scale to remember. Alright, next, this is simple. If patient is on oxygen or room air, if he is on room air, he is going to get 0 score, and if any oxygen like even 1 liter, 2 liter, anything, we need to put dot, and that score would be 2. Then we can write the name here, the device which patient is on, definitely not going to get any score. Then doctor, this is so important thing. Now this is C, this is blood pressure. We are going to fill it on the basis of blood pressure, and remember doctors, this we are going to use just systolic blood pressure, not diastolic. Even the lower most shows 50, we might think that is this diastolic, this is systolic. No doctor, this is all systolic. You can read here as well, score uses systolic BP only. Alright, so you need to use just systolic. Then this is pulse. Alright, pulse, just what is the patient is pulse is having, just put a dot, and on the basis of that patient is going to get score. Then consciousness doctor, I explained before, if patient is alert and active, conscious, just score would be 0. But if he's confused, he's just responding to verbal response to pain and unresponsive, that score gonna get 3 doctors. So important thing, if alert 0, but if responding to pain only, verbal response, score would be 3. And last thing is temperature. Here just put it the dot here, and on the basis of that patient going to get the score, and here then will be total, make the total score. Alright, and then we will interpret what we are going to do. So doctors, just revising it quickly, and I'm going to put dots here as well for your better understanding. So suppose if patient has aspirate rate of 22, we're going to put dot here. Alright, here score would be 2. Then if saturation of the patient is 93, going to put dot here. And definitely we're not going to fill this one because patient is not of COPD. If COPD, we'll just using this one. Next is air or oxygen. So suppose if patient is on 50 liter of oxygen, then we need to put dot here as well because patient is on oxygen. Then next thing is doctor's blood pressure, just systolic blood pressure. If systolic blood pressure doctors is he's having systolic BP of 85, then we are going to use this one, I'm going to put here. Alright, after that if the pulse is 95, we are going to put dot here. Okay, and then consciousness level, suppose patient is alert and active, we're just going to put dot here, but if not confuse anything, we're going to put dot here. And then last thing is temperature. Patient is having temperature of 38.5, we're going to put dot here. Alright doctors, so this is how to fill this, then we'll make total score. So this is 2 from the respiratory rate, then saturation would be again 2, it's 4 now. Then we haven't filled this because this is not COPD case. Then this one, this is 6, this is 9 from the systolic blood pressure, and then pulse would be 10, then 11. So total score we're going to write here, total score is 11. Alright, total score is 11. Now again revising the interpretation last time, if it is 7 or more, then patient need critical care team assessment, patient might need to shift to the ICU. If it is 5 to 6, medical emergency team will come and assess, and then will decide escalation of care. And if it is any single parameter like here, see, if suppose total score is 4, but in single parameter like here patient is having 3, then the ward based doctor will be assessing the patient, will be deciding the escalation of care. Last thing, if score is 1 to 4, simple, the nurse, ward based nurse will be deciding the monitoring and the escalation of care of the patient. Alright, so doctor, so this is all from the news chart. I hope this is gonna help you. Thank you so much.